Mostly I used Marrow during my MD's third year, sir. So during the time, it helped to understand Harrison's better and helped to us to retain also, sir. And it gives us a bit extra information, sir. So this extra information which we retain, sir, then if we take notes, we can easily revise it, sir. In the last 1 month of this exam, sir, it was easy to revise whatever extra points were there. Like sir, you had taught peripheral neuropathy, and there were small points on what causes upper limb neuropathies, what causes autonomic neuropathy, sir. So it's very easy for us to remember in such a way. INSS is mostly specialty based, sir. In that scenario, sir, I think we would have to focus more on the specialty, sir, because the medicine we have done, and it they usually, coming from the exam that I had seen, the medicine is usually not something that is very difficult, sir, I would say. If we have attended the wards properly and we have seen the cases and studied our basics from Harrison, I think for INISS, I think, sir, the specialty of focus should be the one that we should concentrate on. During the MD, sir, it helps us a lot, sir. Seeing the video, sir, they increase our understanding a lot. So we can understand Harrison's also easier, sir. If we have done it, if we have read Harrison's before and we're watching the video, that will also enhance our knowledge by giving some extra points. And even if we have not done the topic, then if we watch the video and then study Harrison, it'll be easier for us to retain, sir. It is a really good way, sir, I feel.
So good evening, guys. So I am very proud and happy to invite Dr. Lalit Kummetha, who has secured rank number 4 in the recently conducted NEET. Lalit, and congrats! I'm so proud to welcome you to this program, and congrats once again, guy.
Yes, sir. Thank you so much, sir. Thank you so much, sir.
And yeah, Lalit, I'll just give you an introduction of Lalit. Lalit did his MBBS from Hyderabad in Medicity Institute and MD General Medicine from Mansi, Delhi. And he passed out in 2022, right?
Yes, sir.
2019-22.
Yes,
Yeah.
sir. Just this year.
And how do you feel right now?
So I'm feeling very happy, sir. Really happy that I can get the choice of subject that I want, sir, in the place that I want.
Yeah, yeah.
I'm very happy,
And
sir.
now you have the privilege of choosing whatever subject you want and which place you want. You can choose that.
Yes,
And
sir. Yes, sir.
there should be a lot of hard work behind this. So, how did you prepare for your NEET as well as your, I mean, not just NEET, your MD medicine, and how did you prepare for the last INA also you had written? You might be preparing for the next INA also because nobody knows what is going to happen in entrance exam. It's
Yes, sir.
always, you cannot tell how much you have prepared, you cannot tell what is going to happen in entrance.
Yes,
So, you always have to keep on preparing for the next coming exam. And there will be a lot of people standing in the queue, like your juniors, many seniors, many people will be there. That will be helpful to them because every year pattern is going to change. Every year some cases will be coming. So you don't know what exactly is happening in the next year because these things keep on happening in India. So,
yes,
so
sir.
how did you prepare actually for this MD as well as for exam entrance?
So I had basically started. I would say I prepared for mainly for my MD exam, sir, because I did not make a decision on the subject that I want until 1 week before the NESS exam, where I had to choose a subject because we had no choice. So I was more focused on studying medicine because I really liked medicine, sir. So I studied Harrison, sir, and some guidelines. In second year, whatever cases that we had, I would go and read from Harrison's. I would see some up to date, and I would use these other various other resources, sir, just to know about how I'm dealing with the patient, sir. This was mainly how I had approached my MD. So, sir, then I think in our third year of MD, then Marrow SS had come out. So at that time, I had subscribed in about August to Marrow SS. And so, sir, and whatever cases we had in the ward, like if there was a paraplegia case, I would come and watch your video, and then we would manage the case. So it would help us a lot in this way. And we used to watch all the exam-oriented cases, sir, like valvular heart disease, like if there is stroke, we would watch stroke, so that we can benefit. It can benefit the patient, sir. So this was my main focus, sir, during my second and third years. So then at the time of our final exams, though, we had to study Harrison only. So, sir, and I used to watch I watched a lot of videos by Rakesh Nair, sir, by you, and by the gastroenterology, sir. So then I had developed slowly, I had developed an interest towards gastro. So I was also watching more of the gastro videos, sir, in the Marrow app. as after when the app came out with the SS. So this was my main focus. So then afterwards, after I had written INI SS, I had not got a decent enough rank to secure a seat in AIMS or PGI. So this time I had we did not know the pattern, sir, exactly how it was,
Yeah, that's
because
right.
there was a court case on what pattern is going to change and what not, and we did not even know the date, sir. So, sir, the 1 month before the date was announced, I was more focused on studying gastro only. So I had watched the gastro videos from Marrow, and I had read a bit of slicing from Marrow, sir. Then once the date was announced, sir, then we had focused on Harrison and the previous notes we had made from the Marrow videos. This is what I had done, sir.
Yeah. Actually, that is what I want to tell us. Like, you don't know what pattern is going to come every year because whatever pattern has been changed. The thing is, like when you're doing the 3 years in MD, whatever is important things or important topics, rather than sitting and reading the entire Harris and mugging it up, that won't help you because like you have to read those things which are the important things, whatever cases you have seen, whatever probable source of knowledge you are getting, especially during your MDNS, you should try to acquire, especially the cases you are seeing. That is the right way, I think, because this year also you don't know the exact pattern. Suddenly the pattern may change. Some case may come in between. So such conditions, actually, I think that is the best way to prepare. And we are also trying to provide the same thing. We are trying to provide whatever is a pattern, the topics remains the same. Whatever be the pattern, topics remain the same, the concepts remain the same. So if we are trying to provide some quality videos which has a concepts and you can use it for any pattern, whatever pattern,
Yes,
or even for your future also you can use. That is actually we are provide everything
yes,
like possible things.
yes, sir.
And how was the how was the exam? I mean, what was the pattern of exam? You entire exam, how you felt it was?
Sir, I felt there were a lot of one-liners. There were some clinical questions also, but there were a lot of one-liners. It was more like a neat PG type of exam, sir. The same pattern. It was a similar type of pattern. Sir, I felt a lot of questions were from Harrison, about 70%, we can say. But the other 25 to 30%, sir, we needed some extra edge to study from some extra places. And I think it helped a lot, sir. Seeing your videos, seeing Marrow videos, there's always an extra edge compared to what Harrison tells us, because you teach at one level higher, sir, as a specialist. Sir, and there were a lot of genetics questions this time, and
Yeah, yeah.
there were a lot of syndromes which were very, it was unknown to a lot of people, I would think.
Yeah, yeah,
Good answer.
that was real. Actually, in neuro, I felt like many questions looks very simple, but they were making it more complicated options, and
Yes, sir.
some questions actually very ambiguous also. And like, how did you plan in the last 1.5 months, just prior to the exam, 1 month or 1.5 months? How did you plan? Because at that time, you know the pattern is changed, and you were
Yes, sir.
reading the astro till that now. Then how did you change that sudden change? How did you do that?
Yes, sir. Sir, I think the date was announced, and we had about 1.5 months, I think, to prepare. About 45 days, I think we had, sir, after the date was announced. Sir, so at that time, I decided that I'll give each topic in Harrison a specific amount of days so that I can finish, so that I can finish and at least have some 5 days to do some revision, whatever fast revision is possible. So, sir, I just opened Harrison's and I saw my old notes, sir, that I made from Marrow and from other sources, because I usually take down notes, sir, when I'm watching videos or doing studies. However, I study, I
Yeah.
usually I take down notes, sir. So it was easy to just see those notes and to read Harrison, the important parts of Harrison, sir, whatever is important, and then I also practice some MCQs from from sources which were there, sir.
Actually, the Harrison, if you take any textbook per se, Harrison or Bradley or whatever textbook you take, a textbook contains everything. Textbook is like it's easy to put everything in a textbook, but difficult to memorize and difficult to understand it. I think our idea also is to give concepts so that it will be easy to approach the tables or easy to approach the textbook. Otherwise, many things you will difficult, especially in neurology part, because I know more about neurology rather than other
Yes, sir.
subjects.
Yes, sir.
Right? But it is very much difficult to completely assimilate under Harrison. But certain concepts it will be a bit easier.
Yes, sir.
And
During the MD, sir, it helps us a lot, sir. Seeing the video, sir, they increase our understanding a lot. So we can understand Harrison's also easier, sir. If we have done it, if we have read Harrison's before and we are watching the video, that will also enhance our knowledge by giving some extra points. And even if we have not done the topic, then if we watch the video and then study Harrison, it will be easier for us to retain, sir. It is a really good way, sir, I feel.
that is exact way to prepare, because like in India, every time patterns keep on changing. Like one time there will some case will go on, the patterns keep on changing. So whatever patterns keep on coming, the important topics are important one, and the concepts will help you to write any pattern, any exam. If you know a good conceptual knowledge, you can approach any pattern. And per se, there are different group of students. One group of students who are preparing for INI, one group of pickup who are preparing for NEET SS, and another group they will be studying for their MD also. So this will actually benefit everyone, because if you, I mean, not about matter, I'm telling about a conceptual way of reading. Like you are telling, your whatever cases you are seeing, you are reading. So that will actually help you to acquire a knowledge that will retain for a long time. You will not lose
Yes.
it if you're seen and read something. And why you have chosen the gastro? What's why you are interested towards gastro? Any particular reason?
Sir, I was actually interested in medicine, sir, but unfortunately it is difficult these days to stop at medicine, sir. So I wanted to choose a subject which is close to medicine. I had discussed with a lot of seniors, and slowly, sir, when I was watching the gastro videos and I was studying gastro, I developed an interest towards it, sir. So I felt that this could be the right way forward, sir.
And what was like you were preparing for the last NEET tests you were prepared? Like you didn't get much time to prepare, but you had written the I mean exam, then you had prepared for this NEET. What is your plan? What was your plan going for next INASS? Or at least like some candidates will be there who are waiting for the next INASS. So what do you tell them? What to prepare? How to prepare? Especially if they have to prepare specialty plus medicine. So how to
Yes, sir.
how to prepare that? What was your plan which was going in your mind?
So for this INISS that we have to prepare, sir, INISS is mostly specialty based, sir. So in that scenario, sir, I think we would have to focus more on the specialty, sir, because the medicine we have done, and it they usually, coming from the exam that I had seen, the medicine is usually not something that is very difficult, sir, I would say. If we have attended the wards properly and we have seen the cases and studied our basics from Harrison, I think for INISS, I think, sir, the specialty of focus should be the one that we should concentrate on.
Yeah, the same thing I also felt like you have to prepare for both, and because this time the pattern was different. Like you all were preparing for a general paper, and
Yes, sir.
then now you have to shift to a specialty. So
Yes,
till now
sir.
you are studying general paper more. Now you can shift to specialty more. And did
Yes.
you have read any of the specialty textbooks you have read? How did you read the specialty textbook during the entire last 3 years?
Yes, sir. So during our MD only, sir, whatever is important, like in second year, sir, we had COVID, so there was a lot of time for us to study in whatever chance we had, quarantine period, we had a chance to study, sir. So during the time, whatever cases we had seen, I think based on the subject of interest, we would study from the specialty book. Like if it's for gastro from Schlesinger, so we would read CLD and how to approach a CLD patient and when to do endoscopy, when to see for varices, all these things, sir. And if it is a stroke, like sir, if it is a case of stroke, we would read De Jong and we would try to see for how to approach it properly, sir. We had a bit of extra time, I would say, because of COVID in our scenario, sir. So that is what, basically, sir, whatever cases were there in the ward, those are the cases we would try to give more extra focus on. So we would try to read those from the specialty textbook, sir. That is, otherwise, the rest was just Harrison, sir, for our MD exam.
And what about Marrow? What all way you approach Marrow videos, as well as there are some exams are going on. How did you approach those things? Whether you like Marrow or any text, you are writing any exams in between, or you are just MCQs you are solving, or you are going for any exams. And how did you prepare for that?
So Marrow helped in that, sir, during our MD. So mostly I used Marrow during my MD's third year, sir. So during the time, it helped to understand Harrison's better. and help to us to retain also, sir. And it gives us a bit extra information, sir. So this extra information which we retain, sir, then if we take notes, we can easily revise it, sir. In the last 1 month of this exam, sir, it was easy to revise whatever extra points were there. Like sir, you had taught peripheral neuropathy, and there were small points on what causes upper limb neuropathies, what causes autonomic neuropathy, sir. So it's very easy for us to remember in such a way that if we take notes, it gets easier, sir. So that was more of how I used it, sir, during my MD days, and I made notes, and it helped me revise it easier, sir, in this last 1 month.
And you are like which place you want to sort right now? Like you're planning for gastros, and which college is your first option you're planning to take?
Yes, sir. So I'm planning to take in Delhi only, sir, in
Delhi.
GB Pant, sir. In GB
Equipment,
Pant.
yeah, wonderful,
Yes, sir.
wonderful.
That.
And whether you are thinking of any other plans, like after, like you have any plan, because you were liking gastro previously also. There,
Yes, sir.
like there are some students which, like me, when I was doing my MD, I don't have any special choice of subject. I was liking every subject.
Yes,
So
sir.
there are another group of students which has interest like you. We have like at the end of MD medicine, you will have inclination towards an individual subject. So
Yes, sir.
such people will plan about something like will go for something special like hepatology or something special at the end of your gastro or something
Yes, sir.
like fellowships
Sir,
or something. Any plan?
and no, sir, nothing. Sir, even I was very inclined towards medicine only, sir. So in the end, I had to make a decision, sir, because now we have to do specialty, sir. So, sir, I had to take a decision, and I wanted something which was very close to medicine. So I discussed with my seniors and everyone, and then I started reading more into gastro. Then I developed an interest towards it, sir.
Yeah,
So
actually, I
I
asked this question. Just want to convey that when you are joining, like there are few students who ask me before joining MD medicine, I have planned for this specialty. Like I want to tell that my suggestion, I cannot tell that this is right or wrong. My suggestion is when you are going for MD medicine or DM, whatever course you're joining, like first enjoy that course and study it better, and at the end point you decide. Never go with a fixed mind towards one subject or one thing. That is why I
yes,
just put forward the question.
yes, sir. It
And
it actually makes medicine interesting, sir, this way, rather than
yeah,
focusing on just one subject. Yes, sir.
and I'll take this nutshell from you that during the entire 3 years of MD medicine, you have to study medicine and you have to enjoy your ward, study more from the patients rather than from textbooks. Read important things from whatever knowledge you're able to get during the 3 years, collect it rather than prepare simply sitting and preparing for one subject. Study medicine as a whole. That is
Yes,
what like nutshell we were discussing, right?
yes, sir. That is what I
And
would say that I have done, sir. Yes, sir.
yeah, that is fantastic. And thank you so much. Thank you so much, Lalit.
Thank you. Thank you so
Nice to
much,
talk
sir.
with you. And
Thank
all
you
the
so
best
much.
for your future.
Yes, sir. Thank you, sir. Thank you so much, sir. It's my pleasure, sir.